Hi, my name is Zach McWilliams, and this is the development of an in-home ambulation device. In the US, approximately 51 million surgeries occur per year, and in 2018, there were approximately 36.4 million hospital stays. This means a little more than 1 in 10 people in the US had a hospital stay in 2018 for an average of 5.5 days. As there are so many people receiving surgery, this leaves many people in a lengthy recovery period in which they work to restore strength and endurance. Although recovery from the surgery itself is primary, the body also requires general cardiovascular reconditioning due to immobility during the duration of the hospital stay. Increasing evidence presents that early post-surgical ambulation can be the key to a more effective and efficient recovery. Early post-surgical ambulation refers to getting patients moving as soon as feasibly possible, and in a 2015 study, knee and hip joint patients who initiated ambulation within 48 hours reduced hospital stay by an average of 1.5 days. Ideally, this ambulation could happen in hospital, but in-hospital rehabilitation is generally limited to in duration with the goal of achieving enough mobility and range of motion for a patient to be safely discharged to their home environment where rehabilitation could continue. This leaves patients with two options for receiving the benefits of post-surgical ambulation: outpatient ambulation or in-home ambulation programs. Outpatient ambulation offers challenges in early ambulation as it often takes weeks to set up, requires patients to ambulate on a scheduled time, and offers barriers in ability to travel, cost, and availability. In-home ambulation relieves some of these challenges, but is often inconsistent and less effective due to the lack of motivation and ambulation knowledge and a fear of re-injury. Overall, patients have the opportunity to have a more effective surgery, less chance of re-injury, and get back to their lives faster, but they lack the resources to accomplish this. Knowing this, we interviewed 21 different providers from pictured companies below, ranging from PTs and OTs to geriatric and rehabilitation specialists to find major pain points in this process. Their responses to our interviews motivated the design of an in-home ambulation device. After assessing the challenges of in-home ambulation, such as safety, motivation, and interruption to day-to-day life, the in-home ambulation device, or IHAD, was developed. The IHAD is a full body weight support ambulation device used to provide full or partial support to a patient ambulating on a passive treadmill type walking device. This device provides support that promotes anatomically correct ambulation and a safety harness avoiding fear of re-injury while ambulating. Similarly, the iHAD allows a patient to remain stationary, allowing for them to participate in more activities that integrate the iHAD into their life, which will keep patients ambulating. Lastly, the iHAD is approximately 40 pounds, which makes it easy to move and folds from a height of 78 inches to 62 inches, with a width of 50 inches and a width of 50 inches to 12 inches. This makes it so the device isn't interrupting usage of other utilities in the home. The iHead removes many of the pains that have previously restricted patients and their families from getting the desired results out of their recovery. To pay for the iHead, there are insurance codes that are specific for devices of this class and category. This device qualifies as a Class 1 medical device, as is non-powered, doesn't sustain or support life and functions, similarly to many other Class 1 medical devices such as walkers, canes, or gait trainers. Similarly, the iHead qualifies as a durable medical equipment, as durable medical equipment is described as reusable devices primarily used in the home that are required to treat, diagnose, or manage long-term or chronic medical conditions. The specific codes we reference are E0642 and E1399. E0642 is used for standing frames that allow for movement either on wheels or through other mechanisms to provide a dynamic standing experience, while E1399 describes durable medical equipment that doesn't fit within any other categories of medical codes, one purpose of which is for new or innovative devices. While iHad prototype has a production cost of approximately $1,000, E0642 provides approximately $2,600 in reimbursement, leaving room for profit and growth. With these estimated costs and selling it at scale, if we were to capture 0.1% of the market of people receiving surgery at a profit margin of 20%, this device would make $26.52 million per year. Thank you.